A number of changes in your health and longevity occur after you turn 50. You may not be prepared for these. First, you actually have more brain function at 50 than you did when you were 25. That's important unless you have a chronic illness like diabetes, hypertension, or other issues that may cause changes in your cognition. These diseases can cause worsening memory and, in some cases, progress to dementia if they're not controlled. Women can often experience a dip in their brain function between age 45 and 55, and this occurs because of the perimenopausal or menopausal changes that occur hormonally, but this usually returns back to a normal baseline by age 60, unless they've had some other underlying hypertension, diabetes, or other vascular changes that would cause narrowing of the arteries in their brain. After age 50, you might experience depression, especially if you had a long-standing medical disease or are a heavy drinker.
No! Not good! The rum!
Yes! The rum is gone!
After age 50, you may experience some depression if you're a heavy alcohol user or you've had diabetes or hypertension or another major medical illness like heart disease. Mental changes and decreased mental function may occur if you sit for more than 7 hours a day in your job or in your capacity and you're not exercising. After age 50, slowing of your immune response can occur, as well as increased susceptibility to infection and slowed wound healing. But this is usually driven by poor diet, lack of exercise, worsening of your protein intake, or notably decreased physical activity. 40% of people over age 50 will have some hearing loss. This is mainly driven by sound exposure, environmental changes, but it can also be related to poor protein intake, as well as weight gain and decreased physical activity. A number of medications can affect your hearing as well, including ibuprofen and Tylenol use chronically. Women, however, will often experience a change in their cognition between the ages of 45 and 55, and this is because of the changes in their hormones that occur as they're going through perimenopause and menopause. But usually by age 60, those cognitive changes improve and they get better. The brain fog goes away, essentially. Slowing of your immune system and poor wound healing can occur if you're not exercising regularly and if you're not taking enough protein or you've gained a lot of weight. Because of changes that occur in both men and women as we age, especially with our hormones, we can see some thinning of the bones or even osteoporosis in some cases. Mild thinning is called osteopenia, but it can progress to osteoporosis. And this can worsen if you're not taking enough protein, if you're not getting adequate vitamin D and calcium in your diet. Also, hysterectomy, where you've had your ovaries removed, can cause, or having your testicular function shut down because of medications with cancer or other causes, can cause you to have thinning of the bones as well, and this needs to be monitored by your doctor. After age 50, you also begin to lose muscle at a fairly significant rate. This occurs mainly if you're not eating enough protein. What I find in my practice is that a lot of patients don't eat near enough protein, and their muscle strength as well as their muscle mass declines. And this can lead to bone density issues, as I mentioned earlier, but it can also lead to balance problems, instability, and weakness that can lead you to fall and break those bones that might be thinner. The cartilage that protects your joints can also thin after age 50. And we see this especially if you're not taking enough protein or enough fat, specifically containing animal-based cholesterol, because that's what stabilizes those joint spaces and the connective tissue between those joints. If you commonly eat the standard American diet, that can lead to those issues. And if your work or regular activity consisted of repetitive activities, like you operated a jackhammer for 20 years of your life, those kind of activities can also impinge upon your joints and cause decay or thinning of the joint spaces. Sadly, after age 50, your chances of a heart attack go up. In fact, they go up by 50%. This is due to the standard American diet that contains a huge amount of sugar and fat. The average American gets 50 to 52% of his calories from carbohydrates, and a significant amount of that often comes from added sugar. If you were to follow a 2,000 calorie diet, that means that about 1,000 calories come from carbohydrates, which is roughly 250 grams of carbohydrate per day, or the equivalent of 50 teaspoons of sugar. That's a lot of sugar. The added additional carbohydrates, despite whether they come from simple or complex carbohydrates, in the presence of fat, increase your risk for heart disease significantly, despite what your coronary cardiologist told you. Even if you're doing calorie restriction or low fat restriction, you're still at risk for heart disease because of the higher sugar intake and the effect it has on insulin and the small LDL cholesterol. You can learn about that by clicking on my link at my website at docmuscles.com. Smoking and moderate to heavy alcohol consumption also increase your risk for heart disease. Additionally, black tea, green tea, and oolong tea increase your risk for heart disease. A lot of people don't believe me when I say this, yet if you look at the countries that drink the largest amount of tea, Turkey being number 1, Ireland being number 2, and the UK generally, or England number 3, you'll see that 45% of all the deaths in Turkey occur because of heart disease, 29% of deaths in Ireland occur because of heart disease, and in England, a 20 to 44-year-old male has a 47% higher likelihood of heart disease, and 26% of all deaths in England occur because of heart disease. Is it your tea? Yeah, it's your tea. Black tea, green tea, and oolong tea. They have a tannin that increases insulin, which then increases your risk for heart disease. Very few people know this. At age 50, hair begins to recede, especially in men. It worsens in women when they enter menopause. This is based on your genetics and your hormones. Hair color also turns to gray as your progesterone levels fall and as your testosterone levels fall. Skin changes also occur as you get over 50, including wrinkling, thinning of the skin, age spots, and risk for cancer in your 50s. This is due to sun exposures, diet, hormones, and genetics, a lack in protein, lack in sleep, yo-yo dieting, chronic dehydration, and medication including ACE inhibitors, diuretics, anti-seizure medication, and chronic oral steroid use all increase your risk of skin thinning and wrinkling. These medications actually decrease the collagen and elastin present in your skin and increase the susceptibility to wrinkles. Additionally, the use of inflammatory omega-6 containing seed oils like canola oil, safflower oil, peanut oils, these increase your sun sensitivity, your ability to burn, the rapid aging of the skin. Vision changes also often start to occur after age 50. Your diet and your blood sugar influence declining of your vision by damaging the lens and damaging the back of the retina in the eye. So controlling your blood sugar, controlling your blood pressure, and controlling your diet are really important in regards to preserving your vision. Even though the average woman goes into menopause around age 51, women can experience the symptoms of declining hormones starting at age 35 all the way through age 55. This is the premenopause, the perimenopause, and the menopausal symptoms that arise. Stay tuned for my book coming out about how to handle your female hormone changes during this period of your life. Hot flashes, dry skin, mood swings, vaginal dryness, urinary leaking, painful intercourse, wrinkling of the skin, and increased weight gain around the middle are all frequently due to a change and drop in your hormones that starts as early as age 35. You're going to want to come and talk to me about your hormones because we can help slow these down and reverse these symptoms dramatically. The same problems that affect your blood vessels in your heart and also in your brain, leading to heart disease and stroke, also affect the blood vessels in your pelvis, especially men. And this is the leading cause of erectile dysfunction, decreased libido, and difficulty performing in the bedroom. As the arteries become narrow because of increased blood sugar, changes in blood pressure, and vascular disease, your risk for erectile dysfunction goes up after age 50 as well. Check out my website at docmuscles.com and click on the link to the newsletter so you can get daily access to this information as it comes to you.